Is when.
Thank you, Rob. Morning, everybody. I'll call the meeting to order. Any declaration of interest you can clear anytime you see fit. Let's move right into our report. Our first report, CM 2520. I believe, Jennifer, you were going to take this.
Sure. Do you need to get a mover? And
oh, sorry, I forgot about that part. The first meeting. Moved by Scott, second by John.
Great. Thanks, Mr. Chair. So this is our operational report, and I'll just bring to everyone's attention that we have consolidated the 3 reports into one. And so each executive director is going to highlight 2 or 3 key points from their report, and then we'll be available to answer any questions related to their home. And Shannon is going to start from Grey Gables.
Perfect. Thank you, Jennifer. So I would like to just draw your attention to a few key items from our Grey Gables report. Under the people section, we continue to color it for our residents by hiring the ESWs, which is the emergency support workers. We are using these individuals to screen staff and helping out on the floors with portering, making beds, answering call bells, helping residents with FaceTime, and supporting other departments within the home. Although our traditional long-term care activities and events look considerably different, we are so proud of the creative and imaginative ways we are bringing joy and fulfillment to our residents. We were able to offer outdoor entertainment to the residents a few times each month. We had a full day of Father's Day events, with one highlight of the day being the local John Deere dealership providing all the men with new hats. Our gardens opened up in June, and many residents spent time wandering and sitting, enjoying the warm sunshine. We also used the gardens to offer barbecues to our residents each week, with the leadership team doing the serving. Many services over the summer months have been reintroduced. We've had the social worker, the hairdresser, foot care provider, our chaplain, the registered dietitian, and the occupational therapist all return to the home, and all are going extremely well, and they're meeting the emotional and spiritual needs as well as the overall well-being of our residents. So that's my report. I will pass it over to Stacy unless there's questions we want answered now.
Does anyone have any questions of Shannon at this time? Seeing none, we'll move ahead with Stacy.
Yes, Stacy at Lee Manor.
Go ahead.
Thank you. Thank you very much. I'd like to also highlight a few areas on the report related to Lee Manor. And the first I'd like to acknowledge is the creative efforts that have been made to engage residents and staff through a variety of recreation and leisure activities. Much like Grey Gables, we've been very creative, and although they haven't been executed the way that we have in the past, they've looked a little different, but certainly the outcomes have been positive just the same. And music is always a welcomed activity and continues to be a planning priority for the recreation department. We've done several outdoor concerts that have been arranged in our center courtyard, and that's a lovely experience for our residents who have courtyard facing windows, so they enjoy the music from the comfort of their rooms with their windows open. And we're also able to bring out residents into that space and maintain physical distancing for them to enjoy that experience. We had the opportunity to celebrate Father's Day, Canada's Day, with lots of fun activities, along with several other seasonal theme days that were organized. Residents always enjoy the energy and enthusiasm generated from these types of events, and not to mention, I think their favorite is probably the festive meals and treats that go along with those occasions. We've probably the most notable change during this period for us was the extension of our visiting options for residents and families. So beginning in mid-June, outdoor visits were introduced where residents could visit with their loved ones through pre-scheduled opportunities at visiting stations set up on outdoors on our property. And these have been very popular and have resulted in upwards of 20 visits per day. And visiting options were also extended during this reporting period with the Designated Care Partner pilot program, which was initiated in the first week of August. And we saw our first official DCP begin on August the 11th, which allowed residents in their DCP to visit with them in their own room and provide support, visiting, and other care-related activities. The second area of the report I'd like to highlight is the resident family council updates. We took a pause related to COVID, and during this period, we were introduced family council in a virtual format using Zoom. And it was really important for family council members to have the opportunity to connect and ask questions, particularly during a time that has seen many changes and rapid developments. So we've received nothing but positive feedback, and the group has decided to meet monthly, whereas previously we would do that bi-monthly. So they're very pleased and the opportunity to stay connected. We also met with resident council representatives. It was very difficult during this period to connect with residents in their traditional form of the resident council, but we were able to initiate a bulletin that was distributed to resident council members and posted in resident living areas that would keep them up on all of the updates happening in the home and around COVID. And in July, a small group of council members gathered to discuss the summer and fall menus, as well as the designated care partner program, to review that and get their feedback about the program. And lastly, I'd like to just highlight our Color It story we're quite proud of. We recruited several ESWs to help support resident care throughout this period. And the majority of these students were university students who had been pursuing generalized health-related programs. And through their experience in this role, they've determined that long-term care is sort of near and dear to their heart. And several of them have decided to go back to school to pursue a more direct avenue related to long-term care. So we're very proud of that, and they're very eager to return in any way that they can to support us here at Lee Manor. So that's pretty exciting. And is there any questions that you'd like to address for Lee Manor?
Any questions from the committee?
Mr. Chair.
Go ahead, Christine.
Thank you, and through you. Great report so far. I really appreciate this. But just if we could just quickly talk a little further in terms of the ESWs, their interest in going back to school and potentially returning to Grey County and working at one of our long-term care homes. What is the time frame for that? And when could we expect potential applications for employment? Thank you, Mr. Chair.
Go ahead, Stacy or Jennifer.
Well, I think through you, Mr. Chair, it really depends on what exactly the career is that the student's looking for. So Stacy might be able to provide some highlight, whether it's personal support workers, food service workers, registered practical nurses, or registered nurses. So it could range from really within the year to 3 to 4 years, depending on what it is that the individual is looking to pursue. The great news is that they're interested in long-term care and have had some experience with us in the county, and we'll do what we can to support them during their break times. If they're on a break from school and are able to provide some support working, they can come in and work some shifts during their Christmas breaks and time off. And that way they can keep the experience going and also provide us the support that is really beneficial for the residents.
Excellent news. Thank you.
Thanks, Jennifer. Stacy, any comments?
No, I think Jen covered that. In this particular case, we did have some students that were in like a kinesiology program and have been now on their radar as maybe doing physiotherapy, pursuing that down the road, but in a long-term care environment. Another had a background completely unrelated, I think, and is now enrolled in courses that will allow her to pursue something more related to social work in long-term care. So two exciting, very exciting cases.
Thank you. Go ahead, Scott.
Thanks, Mr. Chair, and thanks for the report so far. In the reports, you've mentioned about the emergency service workers that we've been utilizing for the last, well, I guess close to 6 months now. Are we at a point to be able to determine whether that's a position that we would like to continue to advocate for with the province without the specified training? Thank you.
Go ahead, Jennifer.
Thanks, Mr. Chair. Thanks, Councillor Mackey, for that question. We are discussing the care support assistant position, which is our words for a more permanent position of an emergency support worker. And we are in discussions with our union partners to include that position as a classification and a position to support the teams on a permanent and ongoing basis. And I believe in closed session, we have a little bit more information about the care support assistant role and some more details on that.
Okay, thank you, Jennifer. If there's no other questions from Stacy and so on, we'll move on then.
Thank you, Mr. Chair. I think I'm up next.
Yes, Karen, go ahead.
Thank you. We were fortunate to have a visit from the Ministry of Health for a week in August. So we had 2 inspectors on site. They originally attended the home to follow up on 5 critical incidents, and we'll talk about those more in closed session. But while they were here, we had another critical incident, so they ended up following up on 6 of these critical incidents. As a result of their visit, they have left 1 written notification related to safe transferring and positioning devices or techniques when assisting residents. And they did require a voluntary plan of correction. We had actually corrected this issue at the time the incident happened, so we had already done all the legwork, and they were very happy to see that. They were very positive about their interactions with staff while they were here. They commented on how willing everybody was to get them the information they asked for, and how positive they were about the interactions they witnessed. So overall, it was a good report. One of the other areas I would like to highlight is related to students. So even through the pandemic, we were able to have RPN students on site from Georgian College for 6 weeks. And their placement time has finished now, but we are looking forward to an additional group of students starting early in November. We also were asked by the local high school if we would consider a co-op student. And so this week we have a co-op student starting from John Diefenbaker Secondary School, and will be working in the program department. And the last area I'd like to highlight is the progress we've made with dining in the home. As you are aware, when the COVID scare started, we went to total room service here at Rockwood Terrace. And part of the need for that was our building layout. Being an older home, we don't have home areas. So our dining rooms mixed floors and had, like, the dining room on first floor had 50 residents in it from a combination of second and third floor. So after doing room service for several weeks, we were able to move back to dining service on the first floor for third floor residents only. So we moved the tables farther apart and actually spread into the library area to accommodate that, and have 2 to 3 residents sitting at a table. Typically where we could, the co-table mates are also co-residents, so that if we have to get into contact tracing, it's not as big a group as otherwise could be. So that's working well for third floor residents in the main floor dining room. They were happy because with the change from room service, it allowed us to put toast back on the menu. We didn't have toast on the menu when we were doing room service. So they were very pleased to get their toast back. For second floor, we also opened up that dining room for as many as we could fit in there with social distancing. But we continue to have some room service on second floor, just simply because the other area we might otherwise use for a dining room, we had to set up as an isolation room. So it's kind of a hybrid service up on second floor, but doing our best to keep the social distancing policies in effect. And with that, if there's any questions specific to Rockwood Terrace, I'd be happy to take those at this time.
Thank you, Karen. Does the committee have any questions? Seeing none? Barb, go ahead.
Unmute me. Thanks so much, everyone, for your reports. Very detailed and interesting progress going forward with the situation we're in. Your comment about the toast made me smile, and I saw Scott smiling as well. And it brings home very succinctly what little pleasures our folks within long-term care really look forward to and enjoy, and you know how simple it is sometimes to think of how we can make their day. So that really will stick with me from your report, that this is a small thing that that we can do, providing toast. My goodness. Wonderful report. Thanks so much, everyone.
Thanks, Barb. Christine, I believe you had, go ahead.
Thank you. And very quickly, well done to all our executive directors and Jennifer as our director of long-term care. Thank you very much for all your attention to our long-term care residents on behalf of Grey County, for sure. I just want to say the consolidated report really speaks very efficiently. I like the comparative chart and all the detail in it. So from my perspective, I really see this as an enhancement. So thank you.
Thank you, Christine. Yes, it's a great format the way you have it set up. It's really pleasing to see that. Okay, we'll move on to our agenda. We're down to
Mr. Chair.
I have something to move it. I thought, I guess I couldn't speak loud enough.
Mr. Chair, you need to vote on the last one.
Oh, we have to do that too, do we?
Yes.
Sorry. I'll ask, is there anyone opposed to our motion on the floor? Seeing none, it's carried.
Also, Mr. Chair, I was neglectful at the beginning that the redevelopment report that was coming forward is actually going to be a verbal one today. So I think it would be appropriate to have the committee just amend the agenda to note that the report is verbal coming forward.
I'll move that, Mr. Chair.
So moved by Christine, second by the warden.
Thank you.
Thank you.
All in favor?
Yep.
Everybody put their hands up. We're just going all over the place here today.
Yep. You should do the votes the same way that you do the movers and seconders.
You just pick them. Make it easy. Okay, we're moving off our agenda. We're down to long-term care. It was moved by Brian, second by Mr. Warden. If there's no discussion or Joanne, I believe you're going to present the report.
Yes, thank you, Mr. Chair. Good morning. I'm bringing a report today to present some ministry funding announcements and impacts for our long-term care homes. I'd like to share my screen if I could and just go through this report with you section by section. If you'll just give me a second here. Can you see my report?
Yes, we can.
Perfect. Thank you. Okay, so I'll start with a quick overview of the Ministry of Long-Term Care funding model. So the funding model is based on a level of care rate per resident per day, and it consists of 4 primary components: the nursing and personal care, which has an acuity adjusted and a non-acuity adjusted portion, and I will explain that a little bit further in a little bit. So I'll go through each of the envelopes. So the first one, nursing and personal care, it funds expenditures related to nursing and other direct care staff who assess, plan, provide, assist, evaluate, and document the direct care provided to residents. So things such as salaries and associated benefits of our RNs, our RPNs, our PSWs, as well as medical supplies and equipment that are used by staff to provide care to residents. Those are the types of expenditures that are funded under this envelope. The second envelope is the program and support services. This envelope funds expenditures relating to recreation, activation, physiotherapy, occupational therapy, social workers, dietitians, those sorts of expenditures. Raw food is the third envelope, and it funds expenditures related to the purchase of raw food, including food materials used to sustain life. It excludes costs relating to the cost of food preparation. That's part of the fourth envelope, which is other accommodation. And this funds expenditures that relate to dietary services, as mentioned. So the cooks, the dietary aides, housekeeping services, buildings and property, operations and maintenance, snow removal, hydro costs, and any other costs that will maintain or improve the care environment of the long-term care home. In addition to these four envelopes, the ministry introduced the global level of care per diem funding as a measure to enhance direct care services and support other operating costs within any of the four envelopes. This envelope provides total flexibility because it can be applied against any of the four envelopes that I previously mentioned. Table 1 here illustrates the level of care per diem. Per diem just means per resident per day. So it illustrates the funding that every home receives in Ontario. So $184.96 is the amount of funding received per resident per day, with two variations to this. This 36 cents under other accommodations in the middle of the table here. It is called the Quality Attainment Premium. And it is a funding stream that's given only to homes that are accredited. So as soon as County of Grey achieves this accreditation, we too will receive this 36 cents per resident per day. The second amount that varies is this $100.26. I mentioned that the nursing and personal care has an acuity adjusted portion as well as a non-acuity adjusted portion. This is the acuity adjusted portion, and it is adjusted by the case mix index, which I will talk about in a moment. But just to provide an example, Grey Gables has a CMI of 0.9999. So this amount becomes $100.25 for Grey Gables. Lee Manor CMI is 1.0233. So this amount for Lee Manor is 102.60, and the CMI for Rockwood is 1.0365. This amount becomes 103.92. So one other thing to mention is that in 2020, we budgeted 1% of a level of care per diem funding increase, and we actually received 1.5%. So this is in table 2, it outlines or summarizes the additional funding that we are receiving over and above what we budgeted because of that extra 0.5%. Case mix index is, so every year around this time, the ministry releases the case mix index classification for every long-term care home in Ontario. The case mix index is a relative measure of acuity for every long-term care home across the province. So the way this is calculated is data is submitted quarterly for regular resident assessments that classify residents with similar needs and acuities. These assessments are processed through weighted case mix formulas, and each resident is placed into one of 34 different grouping categories. This allows the ministry, uses this information to calculate the homes, basically the homes case mix index or CMI. So in 2020 to 21, these are the CMIs of our homes. They did go down from the previous year. So we did have a funding decrease as a result. In March, we gained 5 additional licensed beds The ministry was investing in additional emergency capacity to support adequate space to isolate residents as needed due to COVID. So the ministry granted Grey Gables and Rockwood each 2 temporary bed licenses, and Lee Manor gained 1. As a result of these additional 5 bed licenses, we have $264,000 additional in funding compared to what was budgeted in 2020. Another impact that the ministry has recently announced is the deferral of accommodation rate changes for a 6-month period. So the ministry sets the accommodation rates for every long-term care bed type. So for basic and ward, for private and for semi-private. Normally, the ministry applies an increase effective July 1st. So the rate increase, which was scheduled to be applied on July 1st, 2020, has now been deferred to January 1st, 2021 to provide relief to residents and families that may be experiencing financial challenges due to COVID. The ministry has also announced that it will cover the portion of increases related to preferred accommodation premium during this deferral period. We don't have details at this point as to how much we will receive, but once more details are provided, we will report back how much funding we anticipate. And another new program that the ministry has announced is the Minor Capital Subsidy Program. This program is intended to help maintain and extend the life of long-term care homes. This program replaces a structural compliance premium 1999 funding program, which ended on March 31st. Both Grey Gables and Rockwood Terrace were previously receiving this particular structural compliance program, and they will transition to the Minor Capital Subsidy Program effective April 1st, 2020. Lee Manor was receiving a different structural compliance premium program called Structural Compliance Premiums for Self-Funded Renewal Projects 2009. This program was not discontinued, and Lee Manor will not transition to the Minor Capital Subsidy Program, but will continue to receive $273,744 in structural compliance. The new Minor Capital Program for Grey Gables and Rockwood Terrace will be phased in over 4 years, so homes have time to plan their priorities. This program this funding may only be spent on specific capital expenditures. Routine maintenance is excluded, and any unused funds will be recovered as part of the annual reconciliation process. Table 5 outlines the amounts over a 4-year phasing period for both Grey Gables and Rockwood Terrace. And table 6 brings us all together. So the level of care increase, again, as noted earlier, is the $96,000 additional funding that we received because we budgeted 1%, but actually received 1.5%. The case mix index is a decrease in funding due to our CMIs decreasing. And the additional licensed beds is $264,000 for those extra 5 temporary licenses that were issued to us in March, resulting in an increase overall in funding for 2020 of $213,223. This funding does not include COVID funding and does not, and I haven't discussed any expenditures as well. We will be bringing forward at the next meeting a report to discuss the impact of COVID. And I know this was a very complex funding model, so I appreciate your patience through this, and I'm happy to accept any questions that you might have.
Thanks, Joanne, for an excellent report. A lot of information in there. Can you share your screen, please, so I could see the committee?
Oh, of course, sorry.
There's all the nice looking faces. Does the committee have any questions on this great report? Wow. Oh, there's one. Scott, go ahead.
Well, we can't let an in-depth report like that go without a question. Certainly, it's very complex. Joanna, the county levy that gets applied towards long-term care facilities, where does the bulk of that go? Is that towards which area? We've heard before raw food, basically the amount that we get there covers off. So then we have personal care and other accommodations. Do you have any sense about the percentages of where the county levy goes?
I can certainly look into that and get back to you. I would probably say nursing and personal care is the envelope that costs the most. We also get the most funding for that envelope, but that would probably be where we have the highest costs and where a lot of our levy dollars go.
Thanks. It would be interesting information for the committee because we have heard concerns about the amount of county levy that goes towards our long-term care program. So it would just be nice to have a concrete answer and the justification for that. Thank you.
Thank
Thanks,
you.
Pat. Joanne, a question from the chair, sort of a wide open question. In the 2021 budget coming up with the COVID funding and so on, is it going to make it more difficult for you to set your budgets?
Thank you for that question, Mr. Chair. I think for the 2021 budget, we are going to budget for COVID-related expenditures. It probably will be a little tougher because it's very difficult to predict how the waves will come, whether we'll have a lot of expenditures or not, or if we'll have another shutdown that will result in higher expenditures and more directives. So it might be tough to budget that for sure.
Yes. Is there any other questions from the committee? Seeing none. Again, thanks very much, Joanne, for your great report.
Thank you.
So I'm going to move on for our agenda. We're going to go down to a COVID update, and I need someone to move it to put on the floor. It's moved by Barb.
Mr. Warden, I'm sorry, we need to vote on the last one. Or Mr. Chair, sorry, we need to vote on the last one.
Well, the way I'm going here this morning, I would not be promoted to warden, but is there anyone opposed to our motion on the floor? Seeing none, it's approved. Now we're moving on for COVID funding. It's moved by Barb, second by Christine. I believe, Jennifer, you're going to bring us up, Dee?
I am. Thank you, Mr. Chair. Okay, so this is a COVID update report, and this will be, I don't know, our third or fourth report updating on what's happening with our measures against COVID. So this is for information as well as a recommendation that we'll talk a little bit about infection prevention and control resources and asking that the committee consider including those in the long-term care budget for consideration by council. So we are 6 months into the managing through the pandemic. And one thing that is very evident is that our teams are resilient and quickly adapt to the changes that are necessary to ensure that we're keeping everyone safe, our residents, our families, our staff, and our communities. We continue to offer the surveillance testing. That's the testing for staff every 2 weeks. We offer a couple of opportunities during the time period that the testing is happening to try to make it as easy as possible for staff to come in and have that testing done. Infection prevention and control has been instrumental in our homes remaining COVID-free. So we are currently working on expanding the focus of IPAC within the homes and are looking at opportunities for an IPAC champion in each home. This position will play a crucial role in IPAC preparedness, interval testing, influenza management and preparation, and continued infection prevention and control education and the application of best practices. At this point, we aren't, I don't know, I can't bring to you a dollar amount of what that looks like, but I would like to recommend that funds be added into the 21 budget for consideration. And so we're working through the process to sort out what makes most sense moving forward for 21. Our finance and human resources departments have worked diligently to distribute the pandemic pay. And at the time of writing of this report, first and second installments were paid out. And now I believe all three have been paid out and have been received by our team members. We have been encouraging our staff to take their vacations in order to have some time for their own well-being. And the teams have worked really hard supporting each other to help people get their vacation. And I think it's really important. And I just want to acknowledge the efforts that team members have shown to each other to support that. Throughout COVID, our leadership teams have been providing 7-day-a-week coverage. At the beginning, leaders were rotating working weekends. And as we moved through the reopening and the relaxing of some of the COVID strategies, we have moved to a new normal where we've reduced the number of managers on site on the weekend, however, still have an on-call system so that there is immediate support if something was to come up. And our teams are prepared to resume on-site coverage immediately if the situation changes. We've talked a little bit earlier today about our emergency support workers, and so we continue to recruit ESWs to assist the homes. As we continue to move through the reopening, our residents are venturing out to appointments. They wear their PPE, they're screened on the way out, and they're screened on the way back. We've also had our dietitian, physiotherapist, occupational therapist, foot care and hair care services back to regular routines. Stacy talked a little bit about our visiting, and at the end of this report, there's a chart to outline all of the different requirements and definitions for visiting. If you'd asked me a year ago if visiting could be as complex as it is, I would have never believed it, but it is. And so we're working our way through all of that. So Stacy did talk about we have throughout the whole pandemic offered virtual, window, and outdoor visits. Mid-July, we were able to introduce indoor visits, and outdoor visits no longer required a negative COVID test. We've been hosting virtual family town halls throughout the pandemic, and it was really clear on a virtual family meeting that people really want to be able to hug their loved one. So if they've had their COVID test, they're coming in for a distanced indoor visit, but they really wanted to hug their person at the beginning or at the end. And so we worked with public health and Michael Letourneau to come up with a way to be able to outline what the risks are to the resident and their family member, and to be able to offer this opportunity for a hug. And again, it sounds like something, it's like Councillor Klumpus, you said the things that we take for granted in our everyday life, that when you're living in a congregate setting in a pandemic isn't just as easy as a hug. So we were able to implement that, we are able to implement a 30-second or less hug at the beginning and end of a visit. And while we were working through this, my kids were extremely annoyed because I would hug them, and my little one, she's like, "Are you counting?" I wanted to see how long is 30 seconds. So it turns out 15 seconds is enough to long enough to hug an 11-year-old. But so we were really pleased to be able to offer that. We also heard on that virtual call that children wanted to be able to come in and visit their loved ones living in long-term care. So we were able to update our policy to allow the second visitor to be a school-age child. They still required the COVID negative test every 14 days if they were wanting to come into the house. But it was important to people that we have that as an opportunity. Stacy also talked about our designated care partner program. And so we had a subcommittee work through developing a designated care partner program. This policy and program was modeled after a similar program of the same title, Designated Care Partner, at Hotel Dieu Grace in Windsor. And it's a chronic care hospital that started this mid-June. And I managed to come upon their work, and they graciously had a meeting, answered all my questions, and shared their policies, which we were then able to adapt and revise to meet the needs of the long-term care home. And so we're really grateful for Hotel Dieu Grace and their leadership in introducing family caregivers back into a congregate setting during a pandemic. So we worked with public health, sent them the policy, and got their feedback. Stacy also talked about getting feedback from family members and residents. We wanted to make sure that this met the needs for people. So we did get approval, and we were able to start the pilot the week of August 10th. About 10% of the residents were part of the pilot in each of the 3 homes. And so we were able to slowly try this out and see how it went. Late August, we sent out a survey to residents and their family members about the different visiting options that there were. What kind of visiting did they want to do? Were they interested in being in the next round of designated care partner in the next round of the pilot? And while we were getting their response and feedback, we got new directives from the province. So August 28th, the ministry released the memo allowing short-term and temporary absences. So that's where residents can leave. They can be signed out and leave the property for a short time, or that's a short-term absence. And a temporary absence is if they leave for more than one night, overnight, and what the requirements are upon their return. And then on September 2nd, they introduced new visiting guidelines, which included a caregiver definition that was very similar to our designated care partner. So our homes were well prepared and ready to implement the updated visiting protocols. Essentially, they expanded the designated care partner pilot to everyone. It just moved a little faster than we'd originally anticipated. And as I mentioned, the chart is in the back or at the end of this report to help. We use that chart to support our virtual family call, because there are a lot of things to know about when you're going to visit someone. So partnerships continue to be a really beneficial and essential part of us being innovative and quickly working through the different challenges that come with a pandemic. Our area, Grey Bruce, has a regional IPAC committee in the early stages, working to bring together a regional approach for infection prevention and control practices. And it's early in its stages, but I think it's really important to align the different sectors and make sure that we're applying best practice across all of our long-term care homes, hospital, home care, et cetera. I mentioned our partnership with Hotel de Grace, and that has actually expanded. We have joined in a collaboration with Hotel de Grace Briere, which is linked with CLRI, which is a Center of Learning and Innovation in Aging out of Ottawa, and a gerontologist, Kate Duchek, and we're working together on a formal evaluation project of the Designated Care Partner Program. And these are early adopters of the Essential Caregiver Program, and we're working through what that looks like. So I will keep the committee informed as we work through that process. So going forward, we continue to work on our strategies, manage and monitor our PPE supplies, make sure that we have ongoing communication with residents, staff, families, and the community. We are thankful for the continued support from the CAO, senior management team, and staff in all departments. We are, with the return of school, so that hadn't happened at the writing of this report, we are working through the impact of the return to school and what that means for human resources and people's bubbles and that type of impact. And as you know, the things are changing still as rapidly now as they were in March and April. And so we're keeping up as best we can with the changes and directives, and always making sure that the strategies that we know we can control are that we're vigilant about that in the homes. And that's the screening, the active screening of everyone coming in and going, the universal masking, so making sure that everyone's wearing their surgical masks at all time, and physical distancing and cohorting. So when we're doing small group activities in the home, that if it's not their person's roommate, that there's the 6 feet distance. In staff rooms, that we have the distance from each other, especially if we're taking masks off. now as it's as important now as it was in March and April and May. And so we're always working on that messaging and working through that. So that is the COVID update. If you have any questions, happy to do my best to answer them.
Thank you, Jennifer. Questions from the committee. I believe, Christine, you had your hand up first.
Thank you, Jennifer. Excellent report. I hope I phrased this right. So through all the excellent work that you and your executive directors and staff have been doing, following the public health protocols, do you see long-range planning for all of your new quality assurance key indicators being built into operational practices? Could you elaborate on that, please?
Sure. Through you, Mr. Chair. Yes, I think if I am understanding the question correctly, are the strategies that we are implementing, are we planning on them being a long-term as opposed to more of a short-term crisis response? And are we putting that into our planning? So we are, and it does link with the question around budgeting as well. So we're trying to take some moments when we can to take a breath and do some reflection. We have 6 months worth of data, 6 months worth of experience. What can we learn from that to build into our planning on a day-to-day basis going forward? And so I think that's really important to be keeping those measures on our radar, making sure that we're not just dealing day to day, that we're looking today and tomorrow, and also 6 months and 12 months from now, and figuring out as best we can what that looks like.
Thank you. And Mr. Just a supplementary, if I might.
Go ahead.
And thank you, Jennifer. Excellent response to my question and rewording my question for clarity. I appreciate that. The Zoom meetings with families, I'm hearing they're really productive. Is this something that you and your executive directors would consider as a long-range opportunity? Thank you.
Thank you. Through you, Mr. Chair. Yes, we haven't discussed it as the senior team as to how often or what that would look like, but it is something that we've briefly touched on with regards to redevelopment and different initiatives and opportunities to seek input and provide information. The virtual family calls have been really well received, and I'd have to check with Rob, but I think we've done 4 or 5, and there's anywhere from 30 to 80 people on the call, and lots of engagement, people asking lots of questions. So I do think it's a worthwhile technology to not lose sight of and to use when we need to reach out to broader groups of folks and get some feedback.
Thank you, Jennifer. I believe, Scott, you had your hand up.
Thanks, Mr. Chair. And, as Christine mentioned, I just want to thank the entire team, all the senior management and all the staff. It's great to see that there's been a balance struck now between, resident and staff safety, also in allowing, that social isolation. That was probably one of the cruelest parts of this whole pandemic, was the social isolation that, our residents were faced with. So it's great to see that balance now. And, like you said, Jennifer, those hugs are important. And I guess I'll have to tell my mother that she can hug for 15 minutes now, 15 seconds now. 15 minutes would be way too long, but 15 seconds. So thanks again for everything everyone's doing.
Thank you, Scott. I'm just thinking that if I gave my wife a 30-second hug, she'd wonder what I'd done wrong. Does the committee have any other questions about this great report from Jennifer? Seeing none, is there anyone opposed to the report? Seeing none, so we better move on for agenda. And Madam Clerk, since our CEO is going to give a verbal report, I do not need a mover and seconder.
There will likely be a resolution coming out of her verbal report, but we'll hear from CAO Wingrove first.
Go ahead, Kim. You're muted, Kim.
There, is that better?
That's better.
Excellent. Okay, thanks everyone. So I'm really delighted this morning to say that there has been progress on the redevelopment file in that we took title to the property in Durham on September the 17th. So we now are the proud owners of that parcel of property. We continue to wait for the province to advise on both granting the license for the facility in the new location, as well as to confirm construction funding. And I have reached out to them to see if we can set up a call and get an update on the progress towards those two items. The province has recently announced an update to the long-term care construction funding model. We are going to bring back a report on that, but Kevin's here. And Kevin, did you want to just speak very briefly about what that new funding model might mean for us?
Sure. Yeah, no, it was just announced in August, and they've broken it out into like two pieces now. They've got the construction funding subsidy per diem that continues. It's based on the resident day, but they've also introduced a development grant that's based on a percentage of your capital cost. And then this is all broken down again then based on geographic location and size. So the development grant ranges from 10% to 17% of your construction costs. So this looks promising. That's additional money that could be very helpful. And they're talking that would be available at like time of occupancy or once the substantial completion has been signed off by the architect. So that's nice. You know, the construction funding subsidy is a per diem, so it's based on a per resident day over 25 years, where the development grant would be a one-time upfront funding, which would be very helpful for when we're borrowing, et cetera. So we still have questions. There was items on your increasing subsidy for basic accommodation, but we're not clear if that's on just the beds that are offered for basic accommodation or if that's on all the beds in the home, et cetera. So we'll have to do some modeling with all this, but it looks promising. It looks like additional money for redevelopment, so that's helpful. But we participated yesterday, staff, in a call with the ministry, and again, like I said, there was still they could not answer, but as soon as we have more information, that we will bring a report back and state how this impacts our builds. Okay.
Thanks, Kevin.
Kevin?
So as discussed with this committee back in July, we have a high-level vision for the property that includes the long-term care facility itself, additional housing, institutional uses like the paramedic base, some service commercial, and some of the initial siting considerations. Since we talked to you in July, our GIS department has gathered extensive drone footage of the property, so we have a really solid base to work from, and this is going to inform the required D6 and stormwater management studies that need to be completed. Planning is going to go out to RFP for these studies now, since we've closed, and hope to have this completed by year end or beginning of 2021. We're also working on the planning report that needs to go to West Grey Council to obtain their support for the planned use of the property, and that would be in order to lift the hold on the property zoning. We hope to bring that report, as I say, in November of this year. I think the biggest question that faces the committee and council is how we go about making the decision on the housing aspect of the site. We, over a number of years, have talked about many options for housing. We've talked about a county-owned campus of care, similar to what Simcoe County has. We've talked about a privately developed mix of housing. We've talked about both owned as well as rental, low-rise, singles, towns, etc. There's just a lot of options on the table, and I think it's important that council and yourselves have a really comprehensive understanding and assessment of costs, both initial capital as well as ongoing operating for the various models. If that would be helpful to you to really be able to make a decision I also thought that, you know, there was some potential for this work to inform other, like the affordable housing work that's happening as well. So what I'd like to ask the committee this morning is for your support to obtain some consulting resources to do a really thorough financial assessment on both capital and operating of various models. And Heather's got a resolution drafted. Maybe we can put that up on the screen, Heather, in a minute. But with that, with your support of that, then we can come back to you with, you know, some solid numbers that I think would help you to really be able to make a good assessment of the direction that you want to go, both on this particular site as well as potentially in others in the future. Once the housing part of the site is decided, once you've decided what model you want to use, that will enable us to put together the both the site plan and the master servicing plan for the site. We'll know exactly what goes where, and can then start to think about how the development should be phased. We'll also be able to then think specifically about the long-term care facility itself, and knowing exactly where it needs to go. We can then site it appropriately and get the architect involved in putting that together. So that's my report. I'm happy to answer any questions, and we can then talk about the resolution.
Well, before we go to the resolution, Kim, may I ask you the question? It always intrigues me with COVID going on and so on. There's been many, many changes that probably will happen with long-term care, the way we do business. That'll overly affect the design of this building. It could be bigger, could be smaller. I know it's probably premature, but have you any thought or any conversations about how that might look in the future?
I think that there's work happening at the province right now with regard to design guidelines. And, you know, we expect that they'll, you know, be updating those guidelines. That's why doing this work right now, looking at the site as a whole and thinking about what those companion uses are to the long-term care facility itself. I think, you know, this is a good time to get that work done. And by the time it's finished, then hopefully we'll have some new information from the province, very specific to the long-term care facility itself.
And I would assume that an architect would have to be up to date with that particular change.
I would agree with you there, yes.
Okay.
May I mention, this was identified as a question yesterday on the call on the redevelopment funding. And again, they referenced that they were working with infrastructure, Ministry of Infrastructure on this, and not only about COVID related, but also, and I guess COVID related in design standard for the residents, et cetera, was talked about, but also concern about the costs of construction now and how those have been impacted by COVID on materials and stuff. So those were both that they couldn't answer, but they said they're doing right now as part of the whole redevelopment file.
Thanks, Kevin. Brian, go ahead.
Thank you, Mr. Chair. To Kevin, what is the $1 billion rapid housing program introduced by the federal government?
I don't know, Brian. Sorry, I'd have to look into that. To be honest,
I just saw it flashed across the bottom of the screen on CBC this morning, and I didn't know if it was a new, something new that just came out, but that's what it said. $1 billion from the federal government for rapid housing program.
Wow.
Look into that. So thanks for bringing that to my attention, Brian.
Okay. Christine, go ahead.
Thank you. And through you, I like the idea of working with a consultant to further explore our options. So it would be housing options, paramedic services, and would it also include any related retail offerings such as opticians or specialty footwear? Or is that going a little too far in terms of the scope of what we'd like the consultant to look at?
I think that what this particular request this morning is really about assessing the housing options for us. I think those other pieces are things that we would want to speak to your council about, Mayor Robinson, to understand, yeah, their comfort level and wishes as far as those other pieces. But we know that there is an aspect to the site that would probably lends itself to those kind of supporting services and amenities.
Mr. Chair, at the appropriate time, I would be happy to move or second the request for a consultant. Thank you.
Okay, okay, we'll do that. You can do that when we put the motion on the floor. Scott?
Thanks, Mr. Chair. Kim, would this external consultant, would they look at the business case and the overall operations of the Simcoe County model? Because there's certainly, you know, been some interest in that, but would this be an independent evaluation of what Simcoe County is doing at their campus of care?
I think that that's certainly part of it. There are other models too where you have a third party involved in operating that aspect of the overall campus of care. So I wanted to understand the pros and cons of one and another. So I think the short answer is yes, and I hope to take it further than that.
Good. I was hoping that the short answer was yes. So thanks.
Thanks, Kim. Heather, do you want to put the motion on the screen, please?
Yep, I can share my screen. I can get my mouse to work here. Can you see that?
Yes, I can.
Okay. So it's a pretty straightforward resolution, retaining a consultant not to exceed $75,000 funded from the Redevelopment Reserve Fund.
Okay. Christine has already moved this motion, and I believe Scott was going to second it.
I'll second it.
Okay, is there any discussion on the motion before us?
Mr. Chair?
Go, Christine?
Thank you, and I do apologize for the interruption. This is for the housing options. It's not related to the long-term care beds that are associated with Rockwood Terrace itself.
That's correct.
Okay.
Thank you, CIO.
Mr. Warden, did I see your hand up?
There, can you hear me now?
Yes, we can.
Thank you very much, Kim, for that report, and it's great that we've moved forward with the ownership of the property. I know I was signing papers there back in the early part of September, so great to see, and then I guess there was no snags in the way. I guess everything moved forward as we thought they would. That's great to also hear from sorry, with regards to the idea of an operational grant, or what do you call it, construction grant that Kevin was speaking to. So that's even an added bonus. But I guess with regards to this motion and hiring a consultant, you sort of touched base, and I guess I don't know if you have any update of the beds that we have applied for, extra beds for Grey Gables, but is this something that could also be, this is for the site, but is it also part of that would be the design of what Grey Gables or Rockwood Terrace would look like? Is that expanding from that same?
No, at this stage, this first phase is just to look at housing models. And, yeah.
Okay. Thank you for that clarity. And do you have an update at all when we get through this motion with regards to where our application is for the beds for Grey Gables, or will you speak to that afterwards?
As I mentioned, we know that the province undertook their due diligence about licensing the new site as the site for the redeveloped Rockwood Terrace. I did not hear anything from the province that there were any issues with that, but neither do I have the license. And we are also waiting, as we knew we would be, for confirmation that the project is funded. So earlier on, they had indicated it might take as long as to the end of this calendar year for that funding confirmation to come from the minister's office. So I did send another note just to check in, and as soon as I have that information, I'll let everybody know.
No, it's thank you for that, and yeah, it's great to get moving on this project, and it is definitely great news now that we own that property, and that was always the thing holding us back, and certainly good for Grey County and also West Grey. So certainly look forward to it coming forward.
Thank you, Mr. Ward. If there's no other questions on the motion before us, is there anyone opposed to the motion? Seeing none, it's carried. So let's move on to our agenda. We're down to a closed session. Do I have someone to put the motion on the floor? Moved by Brian, second by Christine. Anyone opposed to going in camera? Seeing none, we are now in camera.
Just wait, Mr. Chair, for Rob to let us know we're back up, and then.
All right, I think we're good to go. If it's just adjournment left on the agenda, I'm not going to restart the live stream. I'm just going to post the entire video when we're done here.
Thank you, Rob. We only went in camera to discuss what we went in camera, nothing more. Do I have a motion to adjourn? Unless we've no other business. A move by Christine, second by Mr. Warden to adjourn. All in favor? Not everybody is alive. We are now adjourned. Thanks, everybody.
Thanks, Mr. Chair.
you.